FFM certification is available for everybody. I do believe they launched it earlier on in the week, if I'm not mistaken. So again, you'll go to portal.cms.gov to make sure that you are certified to sell on marketplace policies. Off marketplace, this is not a necessity. But if you have anybody that's going to qualify for a tax credit or cost share reduction, this is a definite necessity for you to get paid. So why sell Priority Health? We do offer a very competitive commission program where you get 5%, as I said earlier, on new contracts and 4% on renewing contracts. If I'm not mistaken, I do believe we do offer some of the highest commissions within the state of Michigan for both new and renewing contracts for under 65 business. Your clients will get more for their money. Our plans are deemed very affordable, low co-pays, extra benefits, a lot of embedded benefits that they're not paying anything additional for, which I will also touch on later on in the presentation. And lastly, your clients will have access to one of the largest individual HMO networks for primary care providers within Lower Michigan. We do not participate in the Upper Peninsula. We are only in the Lower Peninsula of Michigan. So something to point out. So that's pretty much the entire mitten, excluding the Upper Peninsula. Also, we do have a very well-renowned service team. Our customer service is known to be the best. So this is a good breakdown of the strength of our HMO network. And as I said earlier, Priority Health members will have access to one of the largest HMO networks of primary care providers in Lower Michigan. And that does include nationwide dependent and emergency coverage for members who travel outside of the state of Michigan. We do have a partnership with Cigna, as Cigna's a nationwide carrier. So if anybody's ever traveling outside of Michigan and let's say they break a leg or something unexpected happens, heart attack, stroke, things of that nature, emergency services are covered as in network for all Priority Health members. Okay. One other thing to point out as a selling point, if you ever have, let's say a family of three, a husband, a father, and a child. Let's say the child is going out of state to attend college. We do offer something called an out-of-area dependent program. And the way that works is if they're attending college out of state as a Michigan resident on their parents' plan, they can get services that are not emergency related. They can go in for specialist visits and checkups while they're attending college out of area, while out of state. All they have to do is provide service or customer service with proof that they're attending an out of state college. And because of our partnership with Cigna, it would allow those younger members to still get services out of state and in-network benefits, although it's not an emergency situation. So our network options are pretty simple. We have our broad network, which is going to cover the entirety of the Lower Peninsula of Michigan, and that's our broad network. And that's going to be the largest HMO network of primary care providers. For more affordable options, we also offer narrow networks for our bronze, silver, and gold options. And these are going to be highly restrictive. So I'll touch on the narrow networks briefly as we move forward, but these plans are meant to offer a lower monthly premium because it's reducing the size of the network that the member has accessibility to. So as a quick example, we do have a plan called, let's say it's our Premier Silver plan, but it's the Premier Silver Narrow Network Southeast Michigan. And they do use the verbiage that will say Southeast Michigan or Bronson Care Partners, which I'll also touch on. If you see those, they are specific to that specific hospital network and provider network. If the member goes outside of that network, they will not be covered. So the narrow network options will continue to grow in popularity due to their pricing primarily. All Priority Health plans do not require referrals. That does include our narrow network options. So no referrals are necessary from a PCP to a specialist. The provider-specific names are to make it a little bit easier for you and the clients to understand exactly which facilities are covered. That way there's no discrepancies or confusion as to what doctor or provider the member can go to. And it does operate in the same fashion as a broad network plan variation. However, these plans do not qualify for the out-of-area dependent program that I mentioned earlier for students that might be attending college out of state. They do require the members to receive care at the facilities within the health system's network of hospitals, and care received outside of the network will not be covered, and the member will be required to cover the full out-of-pocket cost for that network. This is an excellent breakdown of the narrow network options. So for starters, we have our Corewell Health West Michigan network. That's specific to Kent County, Berry County, Mecosta County, Newaygo County, and a portion of Ottawa County. So that is specific to doctors and providers that specifically only participate with Corewell Health. So if they go to a doctor or provider that does not participate with Corewell Health, they will not be covered. And this will only populate for the zip codes that you see below. So when you are running a quote for somebody, if they don't reside in that specific zip code, this plan likely won't even be offered to them. So that should alleviate a good portion of confusion. Next, we have our Bronson healthcare partners that are specific to Kalamazoo, Van Buren, and a portion of Calhoun County. So Southwest Michigan primarily. Again, if the member sees any doctor or provider that does not participate with Bronson, they will not be covered. They are restricted to only Bronson healthcare partners. And when they elect the plan, that plan name, let's say they go on a Premier Silver, but it says Bronson Healthcare Partners, the verbiage is in there to let them know that they are on a narrow network to alleviate any confusion. Next, our Southeast Michigan network. That's specific to Wayne, Oakland, and Macomb counties. These are specific to Beaumont and Trinity doctors only. If they don't participate with Beaumont and Trinity, they will not be covered in the Southeast Michigan plan.